How much does endometriosis surgery cost? Let's talk about why this question isn't as simple as it sounds. First, the cost varies depending on the hospital setup, the surgeon's experience, and the complexity of your disease. We're talking about some of the most technically demanding surgeries in gynecology, often involving the bowel, bladder, ureters, or even the diaphragm. If you see someone advertising discount endometriosis surgery, that's a big red flag. Why? Because if it's cheaper than average, it usually means they're still learning and they're using you as a training case. They're cutting corners on equipment quality. They may be reusing or poorly sterilizing instruments. They're operating in a setup without a backup and safety protocols that complex cases demand. These surgeries should never be done in a small nursing home. They require high-end laparoscopic or robotic equipment, full anesthesia support, and a team trained to handle complex pelvic and multi-organ procedures. Insurance adds another layer. In many places, payouts for endometriosis surgery are lower than for simpler procedures like hysterectomy, even though endometriosis surgery can take 5 to 6 times longer. This means costs can feel high even in countries where healthcare is generally affordable. When it comes to endometriosis surgery, you're not just paying for time in the OR. You're paying for the skill, safety, and outcomes. Cheaper can turn out to be much more expensive if it leads to complications or incomplete removal. Share this with someone researching endometriosis surgery. Knowing what corners not to cut can save a life.